Hi, this is Faith Campbell for Healthcare Policy Development, NRN 448. The policy that I chose was marijuana legalization. The reason why I chose it is because even though I'm personally not a marijuana user or have any possession of marijuana, I feel that it is a huge issue that goes on and is talked about in the United States almost on a daily basis, so I feel that it should be addressed. The policy was enacted November 5th, 1996 due to California's Proposition 215. California's Proposition 215 is a California law that allows the use of medicinal marijuana. Now, it was enacted due to the fact that marijuana users are being thrown in jail for, being caught smoking or even having possession of marijuana, which is definitely a small offense considering the fact that there are many other crimes that have been committed and many people haven't gotten much jail time for, such as murder, attempted murder, robbery, armed robbery, rape, things of that nature. This policy definitely affects, in good and bad ways, it definitely affects children, because children have been known to smoke marijuana, teenagers definitely, adults especially, and extremely ill patients. We'll get to extremely ill patients in a second, but according to drugpolicy.org, African Americans and Latinos are more likely to be arrested for marijuana use and possession of marijuana than Caucasians. The results of this policy is that marijuana has been legalized in 10 states, which includes Washington, Oregon, California, Nevada, Colorado, Alaska, Maine, Massachusetts, Washington, and Vermont. According to the United Nations, 158.8 million people use marijuana, whether that be recreational or medicinal purposes. Good thing since this policy was enacted is that 10 states, like they were named earlier, have legalized, which means that the other 40 states have not. Bad things that have happened is that states that haven't legalized marijuana, have wasted, a lot of money throwing marijuana users in jail, which causes states and the whole entire nation a whole lot of money. Like court fees. Like when people go to court, people have to, court has to be paid for. The judge has to be paid, That's a lot of money coming out of the state's pocket. Also, ill patients don't have access to medicinal marijuana. There was always a saying that marijuana kills cancer cells, and, without access to that, patients, they just get extremely ill and, they end up dying. A law is in the works in New Jersey to tax and legalize marijuana like alcohol. So, if you are, 21 years or older, you would easily have access to marijuana. My position on the policy is I feel that marijuana should be legalized because there are plenty of benefits. Like I named earlier, kills cancer cells. It doesn't put anyone in danger, and it can help with terminal illnesses such as cancer. With that being said, marijuana legalization should be continued. It does more harm than good. The United States, that the law with legalized marijuana, it's not all states are gonna legalize marijuana anytime soon. But I do feel that when it is time for all states to legalize, everybody should look at the benefits of legalizing marijuana instead of looking at, the harm that it could do. Because like I said, it does more harm than good. Like I said, my name is Faith Campbell for NRN 448 for the Healthcare Policy Video Project. Thank you.